Hey everybody, welcome to my channel. Welcome to uh, my my maiden YouTube channel. I've been broadcasting on Facebook, and today is the day that I decided that I'm going to make it a deal on YouTube, and I'm so happy I did, and I'm happy that uh, this is going through because actually I was facing some difficulties on Facebook. I've been so used to Facebook, and I keep calling Facebook. So I've been facing some difficulties connecting on Facebook. I wanted to go live on Facebook and YouTube simultaneously today, but for some reason, I had technical difficulties on Facebook. So for those who will be joining me subsequently on my page, I heartily thank you so much for stopping by, for checking my page. And today, it's a topic which so many people in sub-Saharan Africa, they go through, the face, and it is nothing but the common pandemic or disease that we all know, malaria, which of course is transmitted through an insect called mosquito. And so the reason I decided to talk about malaria today is because the Cameroon government, with with other African nations, that is, it is uh, the United Nations here, you know, World Health Organizations, in partnership with African countries, uh, making it putting efforts, to see that this virus can be limited, or maybe I think what they're trying to do is not eliminate the virus, but to kind of reduce it. So again, thank you for being part of my channel. Thank you for stopping by. I'm going to try to see if I can make this working on Facebook. Excuse me. And give me a few moments if I can give a few bars of music before I see how I can make this work on Facebook, so that the people who've been following me on Facebook will know what is happening today. For some reason, network seems to be not working on my side, and I don't know why it's working on. It's going live on YouTube, but it cannot work on Facebook. Uh, I'm trying to see if I can get you some music here, which is also kind of proving difficult. Wow, it's one of those days that it's like everything works against you. Oh wow. So the reason decided to talk about malaria today is because, again, as I said, they're doing working with African countries to see that they get to eliminate the I mean, I keep trying to call it something else. The malaria disease on the continent, and I think especially in sub-Saharan Africa, where the disease is, it's a problem, for most people, especially for younger people. It's a big problem. So the World Health Organization has, they've done some clinical trials in they say in three countries. That's Malawi, Kenya, and Ghana. And so the clinical trials, they say, have been successful, and they've been able to curb, the spread of the disease. But I have questions. I have some reservations as to, is that the best thing to do at this moment, given that there are so many things which are still challenging, so many things which I think will work against, things that will work against vaccination. So my conclusion is that vaccination at this moment is not the best thing, the best thing for any reasonable government to do. You know, it's not the best thing for any reasonable government to do, given that there are so many things which, kind of counter this effort, and so it will be another waste of public funds. It will be another waste of funds that could have been used for, better things, instead of embarking on the mass vaccination. And the reason I say this is, according to the world, according to the latest World Malaria Report, I mean, this is from the United Nations World Health Organizations, there were about 249 million cases of malaria in 2022, compared to 244 million cases in 2021. So there's been an increase. The estimated number of malaria deaths stood at 608,000 in 2022. And that's compared to 610 thousand in 2021. And this is a report which was brought in December of 2023. So it's a relatively new report which the United Nations published. So the World Health Organization, for the African region, continues to carry a disproportionately high share of the global malaria burden. In 2022, the region was home to about 94% of all malaria cases. 94% of all malaria cases. And 95% of the malaria deaths are from this region, sub-Saharan Africa. Children under 5 years of age accounted for about 78% of all malaria deaths in the region. Again, as we're talking about the region, this is sub-Saharan Africa. So it is on the backdrop of these statistics, that the World Health Organization has embarked on, an ambitious program. They call it an ambitious program to eliminate malaria, by mass vaccination, of children under the age of 5 years old, under the age of 5. As I said earlier, successful trials have been taking place in Ghana, Malawi, and Kenya. And so Cameroon is being the very first, sub-Saharan African country to launch the world's first malaria vaccination program for infants. And the World Health Organization, they call this a historic step for the children of Cameroon. And if you if you follow this recording later on, I wonder what your take is on this historic step for the children of Cameroon, and subsequently for the children of Africa. Do you think this is, as they call it, it is a historic step? I wonder what you call it. And That comment was made by, you know, uh, the chief of the World Health Organization, a son of Africa from Ethiopia. His name is Dr. Tedros Ghebreyesus. He called this the beacon of hope for the children of Africa. This is what they call it, a beacon of hope for the children of Africa. I mean, as a kid growing up, I have suffered greatly. I suffered greatly from this disease of a thing called malaria. And I cannot tell you how many times I was hospitalized. I cannot tell you how many times I was hospitalized for malaria, and I cannot tell you how many times I took self medication. Because it was already a routine. When these symptoms will pop up, automatically my parents will know that it was malaria, and they will give me, they will provide medicine for me, medicine that they will get from the store. And it is until when it has reached a certain age, when it's reached a certain stage, that they cannot handle it at home no more, and then I will be rushed to the hospital. And even as I grow up, I have self-medicated myself, and until it reaches a certain level that, okay, this I cannot handle no more, then I'll rush to the hospital. So if this truly is something that will work, then it is really a beacon of hope for children of Africa. But is it a beacon of hope? That's the question. Is it a misplaced priority? They call it a beacon of hope, but my problem with this is that there are things which they were supposed to do, and we're going to get into what I'm saying. There are things which they're going to do, but first, you know, uh, let us see how mosquitoes, or what really causes malaria in the first place. Malaria is the problem here, but if we can contain malaria, then that will be that will be good. And how do we contain malaria? We contain malaria by containing the insect that spreads the disease. And so the question I ask is, what is when I got this news, the question I asked was, what is the leading cause of what is the leading cause of malaria? Okay, I'm sorry, I had some interruptions. Right. What is the leading cause of malaria? It says malaria is malaria spreads mostly to people through the bites of some infected female Anopheles mosquitoes. Blood transfusion and contaminated needles may also transmit malaria. And this is from the Center of Disease Control, the CDC. The CDC is America's Center for Disease Control. So I'm going to take the first cause. Malaria mostly spreads to people through the bites of some infected female Anopheles mosquitoes. We're going to focus uh, on this cause through which malaria is transmitted. So if malaria is mostly transmitted through mosquito bites, that means the best thing to do is focus on eliminating mosquito in the first place. If we say we are focusing on vaccination, then maybe we are not hitting the target, because remember, the most important thing in all of this is to hit the target. And if we hit the target, then we have done with this disease of a thing. So when I when I when I when I went to find the cause of malaria, you know, my my next question was, how will this vaccine that they're talking about, how long does it stay in the human body? But first, we know the basic ways through which mosquito can be contained, and mosquitoes spread, mosquitoes breed in standing water. So the first and most important step in controlling them is to find all the places where water can accumulate on your property. You know, treat water that can't be drained, manage sewage, manage waste properly. These are the three most important ways to contain mosquito. You know, standing water, growing up, we were told this is the most common way through which mosquito breeds. And I remember back in the day how my father used to, he will do everything in his power to say that we will not have standing water, around our surroundings. And in areas where he couldn't avoid standing water, one thing that he had done was that he will always use used oil, use used oil, like the engine oil, and pour in these places so that the engine oil kind of canopies over the water, overshadows the water, and in that case, mosquitoes will not be able to breathe in this water pools. So these are some of the most important things to do, and we know how it is in Africa. Waste management is one of our biggest challenges. So if we cannot take care of this problem and say we're going to do mass vaccination, and tomorrow the mosquitoes keep they keep multiplying. You know what I mean here? The mosquitoes keep coming and in greater numbers. And like in the urban centers, uh man, I remember once I was sick, that was in 2008. I was sick in Douala. And I think this is one place in Cameroon that has the highest level of mosquito. And I don't know how it is in your own city or wherever you are in the world, especially in motherland. But I was sick. I got admitted in one of the district hospitals there in Douala, and you know, waking up in the night, man, waking up in the night, the wall, because the sick bed on which I was like the last bed on the wall. Waking up in the night, literally the wall was red, small dots, 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 dots. And those were mosquitoes that have been feeding on me. Those were mosquitoes that have been feeding on other people in that same world, because it's a world which contain about 10 people. So those were mosquitoes that have been feeding on all of us. And while I was being treated for the mosquitoes were taking my blood, and I'm sure they were transmitting to some other person. Probably the other person didn't, if he or she didn't have, malaria. Or if I was at that same time that I was being treated, I was being infected by the same, the same virus that I was being treated for. And so even our hospitals are some of the best breeding grounds for this disease, for this disease transmitting insects. Because I mean, I cannot tell how nasty it is in the hospital where I was. And it is the same case with other hospitals. You know, waste management in these hospitals, physics all over, and you name it. These are grounds in which mosquitoes thrive. And so These children are being taken to these hospitals to be vaccinated. And it is in those same places that they will be bitten by this insect. Are you talking about all public places, schools, markets, you name it. You're walking down the street in the cities, and you just see piles of dirt upon dirt, and standing water in little containers to the biggest containers that cannot be taken care of. And these are things which our governments are skipping, and they're going to, I think what they're doing is they're doing the last, instead of them taking the first step, they're taking the last step. So sanitation remains one of the biggest problems. And it is so sad because in the 21st century, we're still talking about sanitation. These are things that cannot be taken. And these are very simple things which were supposed to be taken care of without any problem. Yet we want to jump and say we're doing vaccination. I don't have a problem with vaccination per se, but what they're doing is not right. If you're doing the right thing at the wrong time, then you're doing wrong. You're supposed to do the right thing at the right time, at the right place. So it's another, I think, according to me, it's another misplaced, another misuse of public funds. We may say this is being provided by the United Nations. Who's the United Nations? The United Nations is just another body used by the big powers to, do what they want to do. As we all know, they may say, "Oh, they're giving it. It's a free gesture by the United Nations. Nothing is for free, people." At least that I learned from Patrice. Not Patrice Lumumba. I learned from Thomas Sankara, whereby he warned his people and said, "There is no free meal, people. No free meal. He who feeds you controls you." And so, for all the years, the United Nations is you know, an arm for the big boys. And they will tell you, "Oh, we are doing this to help. We are doing this for the love of humanity." No, it's not. They know how they get paid in return, and so this is just another way. It's not just another misplaced, you know, just another misplaced priority. You know, standing water, waste management. These are things we should have been, which are these are things we should have been taken care of at this moment. These are things we should have been taken care of at this moment. I mean, I keep having some interruption here. Uh, so so again, let me ask: Are the African governments doing enough to focus on the cure than the cause? Yep, they are focusing more on the cure you know than the cause. Rather, if we are focused on the cause, we will take care of the cure. So, as I said earlier, I was wondering how long this vaccine of a thing stays in the human body, and I want to share with you what I gathered. Uh, it is said, given the rapid waning of protective immunity, a booster dose is recommended 18 months after completing the primary immunization. So, after 18 months, a booster dose is recommended after completing the primary immunization. It further says the vaccine is the first malaria vaccine approved for public use. It requires at least 3 doses in infants by age 2. At least 3 doses in infants by the age 2, with the fourth dose extending the protection for another 1 to 2 years. You get that? It requires at least 3 doses in infants by age 2, with the fourth dose extending the protection for another 1 to 2 years. The vaccine reduces hospital admissions from severe malaria by around 30%. 30% is not a good number to go with. It is not. So if we follow what the head of the World Health Organization said, this is a beacon of hope for the children of Africa, and it only reduces hospitalization by 30%. So the remaining 70%, how many children do we have on the continent? A lot. So this is not an encouraging number. It is not a beacon of hope for the children of Africa. But we all know what to do, from our governments to you and I. We know what it takes to do to see that we can greatly reduce this deadly disease. We often say, "Oh, the government, the government, the government." We have our own share of responsibility. The government can do to a certain extent, and we have to hold the government to do their part, which they have not been doing. The streets, I'll keep calling Cameroon here because I think that's my point of reference. And I think Nigeria is not that different. A whole lot of countries in sub-Saharan Africa are not that different. As I said earlier, my father used to, the man hates, up till today, he hates dirt. So when we were in primary school, there was a song we used to sing. Malaria is a very bad sick. Malaria is a very, very bad sick. Malaria is a very, very bad sick. We must keep mosquito away. We are not saying we should keep malaria away. We should keep mosquito away, because malaria comes as a result of mosquitoes. So if these people say they're going around and doing vaccinations without keeping mosquitoes away, are they doing anything? No, they're not doing a thing. But at least you and I know how we can keep mosquitoes away in our own small, in our own small ways, in our own small areas. Fight standing water, fight waste which is often thrown around. Fight, when we talk about standing water, anything that can hold water for some days. We have used tires, we have all kind of containers, we have used shoes. Yeah, we have used shoes which sometimes when it rains, these shoes hold water. We know all those things in our communities that hold water, and these are breeding grounds for mosquitoes. So we must keep all these things away. And as I mentioned my father again earlier, places that he couldn't keep this water away, he used motor oil. They used motor oil. Mosquitoes cannot breed in areas where when you pour the oil, when you pour used motor oil on water surfaces, it spreads through on the surface of the water, and so these mosquitoes cannot breed in such areas. And these are things you and I, we can do. We can have used motor oil, maybe even for nothing. I hear today that motor oil, this used oil is being recycled, but you can still have it for free. Walk into any filling station, any gas station, petrol station. I mean, back home we call it petrol station. Walk into any petrol station and and demand for used oil. You will have it for free. So if we have all these things at our disposal, why do we want to take the risk? Why do we keep laying, the responsibility on the shoulders of the government? I'm not saying the government shouldn't do anything. The government has its portion of the blame, its responsibility, but you and I, we have our own responsibility. So it is not until we take care of our responsibility that we then go and ask the government, but why haven't you been taking care of yours? And as we used to sing back in the day in primary school, we must fight, we must keep mosquito away. When we keep mosquito away, then this thing, it will be reduced, and maybe someday it will be eliminated. And just as this news about vaccination came out, uh, I want to be clear on this people. Uh, it is reported that Seychelles, if it's not Seychelles, uh, has been certified as malaria free. Which African country has been certified malaria free? It's not Seychelles, it's Cape Verde. So the World Health Organization and it is just the third African country to eliminate malaria. So as I was following the news, I was confusing which country I heard. Was it Seychelles or was it Cape Verde? But Cape Verde has eliminated malaria, and it's been certified by the United Nations that they are malaria free. And I think it is but just important for other countries to ask, what have you people done to eliminate this virus? To know the measures which they took, to eliminate this virus. Is it through mass vaccinations? Is it through, good sanitation? Is it through, everything that they did? And so it was a good news for me to hear that an African country has been certified as malaria free. And so that means we all, if we hold our governments accountable, if we hold ourselves accountable, then someday this disease, which claims a lot of hundreds of thousands of lives in Africa each year, will become history. So I'm going to draw the curtains here. I thank you so much for uh, stopping on my page. I hope you get to click my follow button. Please do, and if you can, click the notification button as well. And if you can, please share for others to be part of this community. As I said, it is my first time to go live on YouTube, and I will be coming on more and more. Sometimes it's difficult to take the first step, but once that first step has been taken, then the rest can come in sequence. So uh, I'll be I'll be making more videos. I'll be finding time to sit and talk on some things here, which I think I do have a lot to say. And of course, we all have a lot to say. And let me know what you think of African countries embarking on mass vaccination. Let me know in a comment. And I'll see you next time. Bye bye.